Hey everyone, thanks so much for joining. Just waiting for Dr. Ava. Just a couple more moments. Thanks so much for joining.
Oh.
Hey, Dr. Ava.
Hi, May. Here I am. Hi.
Oh my goodness. Are you on?
I'm in Hawaii. I'm in Maui. Let me just get a book to put this on. I'll be right back.
Perfect. Thanks so much to everybody joining at home. We're so excited to have you. While Dr. Ava is grabbing her book, when did you get to Hawaii, Dr. Ava?
I got here, when did I get here? On Saturday afternoon.
Oh, that sounds amazing. So jealous of you. Well, thank you for joining us. Everyone at home, thank you guys so much for tuning in today. My name is Meg Storm, and I am the editorial director here at AEDIT. And today we're talking about a really fun topic, and Dr. Ava is in the perfect place for it because she's going to be talking about it a lot this week as well, where she is. Basically, we all know there's no right time to get a procedure. What the right time to get a procedure is when it's right for you. But the new year always kind of feels like the perfect time to talk about trends and to get excited about what's new and what's next. And I think in terms of innovation, the kind of non-surgical, minimally invasive side of the industry really feels like where all of that newness and technology lives. So today we have the one and only Dr. Ava Shamban here to join us to talk about all of that. And really, Dr. Ava needs no introduction, but she is a board certified cosmetic dermatologist based in Beverly Hills and Santa Monica. She's also the co-founder of Skin 5 Med Spas in LA. She's the creator of the Box by Dr. Ava, which is an amazing quarterly subscription box. And she is the principal investigator in a lot of clinical and FDA trials, which is partly how she always kind of knows what's coming, whether she can divulge all of her secrets or not. She definitely knows what is coming down the pike. So she is the perfect person to talk about all of these trends with. Dr. Ava, did I leave anything out?
Yeah, no, I think, no, you didn't. And I think that there's a lot of interest right now in prejuvenation, juvenation, and rejuvenation.
Absolutely.
Yeah, so I can talk a little bit about what's coming down the pike. So first of all, there was a study that was completed with the Allergan product Glow Light. And so since I was an investigator, I can't divulge the details, but it is public information that there was a study, and it was done for improving skin texture by these sort of micro injections all over the cheeks. And so that's very exciting because we do know from other scientific studies that hyaluronic acid in and of itself does increase collagen production and improve overall skin texture. So the results of that trial are pending, and so that's pretty exciting.
And can I ask you, it's kind of, for people who aren't familiar, it's kind of a combination or somewhere in between hyaluronic acid-based skincare that people are used to and a dermal filler, right? Because it's more superficial injection-wise.
Yeah, so it's considered to be a skin booster.
Okay.
And so it's injected at the very top of the dermis, so in an area where you could improve fine lines and wrinkles. And so there's different ways of doing it. You can chase the fine lines and wrinkles, and then ideally, if you're really giving the skin a boost to stimulate the collagen production, then that would be ideal. That would be ideal. So that's one thing. I think there's yeah, go ahead.
No, I was going to say also on the injectable front, what else are you kind of excited about?
Well, I'm also excited about, there is, let's see, in the prescription, I'm also excited about the hyper dilute radiesse. And so this is where you take the syringe of radiesse, which is a different product. It's calcium hydroxyl apatite. And so then you blend it with some lidocaine and some saline and maybe something else in the future. And then you inject it in areas where there's crepiness or deeper lines or wrinkles that typically you would treat with a laser. So it can be done almost in a way like a skin booster, except it's injected a little bit deeper, and it's for really an older person, not for you with your perfect, beautiful complexion. But you can do it in the neck, you can do it in the décolletage, you can do it in the arms, you can do it in the thighs, and in fact, it's a way to treat cellulite. And so typically what we do is one treatment every 3 weeks for a total of 3 treatments, and you get, not only you get an improvement in the crepiness of the skin, but you also get some tightening. And so that's very exciting as well.
Okay. And how long do those results last?
How long do you what?
How long do those results last?
Oh, well, that's a good question. Probably most of the results we can kind of say a year, you know, and then you may need to repeat. But once you start on the trend, if you're following it up with good at-home skincare, maybe an at-home device that has some lights and maybe some microneedling, then you can improve those results and maybe stretch out your in-office treatments. But they all go hand in hand. They're also,
for sure.
They're also, so we know that the skin is composed primarily of collagen, but it also, which is 70% of the dry weight of skin, but elastin is 2% of the skin. And elastin is what provides the snapback quality. So when you lift up your skin and you let it go and it snaps back, that's the elastin. So Allergan/AbbVie has purchased a triple elastin, which is a progenitor of elastin. And so that will be, I mean, they haven't started clinical trials yet, but that will be something exciting coming down the pike as well.
That is exciting. I hadn't heard that yet. And then on the botulinum toxin front, I know that it feels like we've been talking a while now about maybe shorter acting, longer acting. What do you kind of think? Do you think either one of those products are going to come to market this year?
So I've been an investigator for both of the products. One is from the company Revance, and they don't have their formal name yet, but it's daxibotulinum toxin. And so that one, the approval was pushed off. They had basically a lot of paperwork that had to be done, validating, I don't know the details, but everything's fine with the actual product.
Okay.
And as I said, I treated, probably 50 patients in the last several years with the product.
Okay.
And it has more longevity, probably. I can't say because it hasn't gotten its full approval yet. And so that we're really looking at, because the FDA, and it is a drug, it's not a device, and the fillers are devices.
Yeah.
That we're looking at an approval at fourth quarter 2020, most likely. The shorter acting toxin, that's the one that kicks in like in an hour.
Yeah.
That's one's called Bonti. That's just entering its phase 3 trial. And so I participated in an early phase 2 trial, and so now I'm about to start the phase 3 trial. So
exciting.
We'll see how that goes.
Yeah, nope, love that. There'll be lots to talk about there for sure. I would love to kind of move on to threads, because I know that thread lifts are a big part of your practice and you've really pioneered a lot of those techniques. So for anyone who's unfamiliar, can you just kind of give a little bit of a background on why threads are so great, and then kind of some of the innovative ways that you're starting to use them?
Yes. So when we look at the tools that we have in our box for improving the quality of skin and changing the way we age, we know that we have, toxins or neuromodulators or wrinkle reducers, whatever you want to call them. They're very safe, that help relax dynamic lines. So when you frown, I don't know anybody who's frowned for the past 30 years probably, or 20 years anyway. And then crow's feet, also when this muscle pulls a part of the mouth down, you can use it to reduce the masseters, you can use it for the neck. So those products also seem to have a physiological effect in that it does change the way you age when you look at twin studies. So that's one. And then you have fillers. And so fillers are used not only to treat lines and wrinkles, but obviously to contour the face, to enhance the lips. There's all kinds of ways that we can use fillers really creatively now to give you more of a chin, a nice sharp jaw. All you guys know about that. So threads came about because we know that the top layer of the skin envelope, starts to descend. And so to bring it back up, it used to be only surgery or pretty intense laser.
Yeah.
So they thought, well, why not, like when you hold your face up in the mirror like this, why not if we just put like a thread in and then just lift it up? So the way they work is it's a long thread and it has little barbs. Under the dermis, so that's one of the top layers of the skin, there's a connective tissue web. And so the thread is placed there and those tiny little barbs hook on to that connective tissue. And as you pull it up, it lifts up the face. And so we use it not just in like your mother, but also in younger people along the jawline. And then you can also insert one here to kind of just lift this whole area. There's all different kinds of ways to use the threads. And so there is a very exciting, it's been around for a while, but I think it's now just kind of hit its stride.
For sure. And there was kind of a older generation of threads that maybe weren't as safe and effective. And then this kind of newer generation, for anyone who is maybe familiar with the old connotation of threads, they've really come a long way, right?
Yes. So the old threads were non-absorbable. They didn't absorb. They were nylon. And so they were around like 20 years ago, and people would get them placed, and I'd be pulling them out because the body would spit them out like a splinter.
Yeah.
And so the new generation of threads, those still are around, but not used at all, pretty much.
Okay.
The newer generation of threads are biostimulatory. So they stimulate your own production of collagen. So over time, you get a nice lift from the thread. There's a company called Aptos, which is actually from the country of Georgia. And I was fortunate enough to be able to go there to see how they use their threads. And so they have the PDO threads as well,
Yep.
which is the most common type of thread that's currently available here. But they also have a PDO thread that has hyaluronic acid around it. So that's like the filler. So
Yep.
we know how biostimulatory those are. So it's very exciting.
That feels like the perfect combination of kind of everything that we know works in a really synergistic way.
Yes. So they all work, everything works together. It's not just
Yep.
one together. Yeah.
And so when you place the threads, do you kind of see an immediate lift and then the biostimulatory kind of effect kicks in over time?
Yes, exactly. So you see that like, woo, and then it kind of drops a little bit, and then you have to wait like a month or 2 or 3 as the threads stimulate the collagen production, and then you get more of a lift.
And then you use them on the body too, right? In certain instances?
I actually have not. I mean, the neck, yes.
Okay.
But they can be used. I haven't really done that much of it, but they can be used like for knee sagging.
Okay.
You can lift the knees. You can do threads that aren't barbed, like in post baby belly. There's all kinds of different ways to use the threads, and I haven't done that work so much. They do a lot of that actually in Russia, but that'll be coming up in my office.
Coming soon.
And
then are you doing them in men and women equally, or do they kind of, what are you seeing? Is there any trends specifically for men that you're seeing lately?
Yeah, so we certainly have bro talks.
Yeah.
Bring in, hey bro, where can I get some talks? And so that's becoming much more common. And I think the men are cottoning on. The men want to look really good too, doesn't matter what their age is. They don't want they don't want women to be ahead of them in the beauty category. Well, the handsome, whatever, beauty, handsome, same thing. Beauty, handsome, same thing. But men really like that thread lift because sometimes they don't want any filler. They've got bigger bones than we do, and they've got bigger fat pads in their face, and so a lot of times what happens to a man is more of the sinking, the melting. So you want to lift them.
That makes sense. And then if we kind of move on to our next trend, I know you're doing a lot of combination therapy, a multimodal approach to kind of layering different treatments, which you've already kind of started to hit on a little bit, but I feel like there's a whole world of some of these tools and modalities like radiofrequency and ultrasound and some of these other non-surgical, tightening and whatnot procedures. How has that really changed for you in terms of how you're able to give someone a more comprehensive result with all of these different technologies.
Yeah, it's quite dramatic actually, because the sum of the parts, or the whole is greater than the sum of the parts for sure. Yep. You get a synergistic effect. So that's why we like to design a treatment plan for people where we figure out what we're doing when. So for people who have more laxity, for the older patient population, we often will combine a radiofrequency microneedling then with an ultrasound tissue tightening. So we combine, for example, the Morpheus 8
yep.
along with the soft wave. That's one of our favorite combinations. And so depending on where you are in your life, we may just do one, and then we may do the other later on. And then if you're a little bit more mature, we may do both. Not exactly together, but maybe just a week apart, and then just do a series of 3 of each of those. We also like to do a lot of Fraxel, which is the fractionated laser. And so what happens with the Fraxel is that you create these tiny little microchannels in the skin, and through these microchannels you can deliver things like PRP, which of course has growth factors, and also we have some really nice exosome cocktails that we deliver too through these channels.
That's amazing. And I feel like that it's almost all of the buzzwords that we've been talking about for the last several years, kind of all now starting to really be looked at, to your point, holistically, and how they can all complement each other, it feels like.
Yes, and so we, depending on how much sun damage a person has, and we do entire body. I mean, I'm in Los Angeles, where every body part is out there.
Yep.
So we treat, neck, chest, neck, full arms, full legs. And it's amazing how the texture of the skin can be improved. And, so your generation, look how flawless your skin is. I mean, you're super careful about your sun exposure. You're, I'm wearing my hat. I don't get going on. I'm here in Hawaii. I have a full body, swim rash guard.
Yep.
Someone said, where'd you get that? Called tutu glue. But listen, sun damage happens. And so it's really nice that we have developed ways of reversing it and really bringing the skin back to its pristine condition. But yes, it's all about combination therapy, and within the therapy, we combine things. For the Fraxel, not only do we do PRP, maybe, or exosomes,
yep,
but we also will do hyperdilute Sculptra. So Sculptra,
interesting.
Yeah, that's polylactic acid.
Yes,
and so that also stimulates collagen production too. So
do you do those injections the same day, or does someone need to come back for those?
No, we actually apply it on top of the skin.
Oh, wow. Okay.
But sometimes for the décolletage, for example, if people are starting to get those, those boob wrinkles.
Yep.
Then we will inject the Sculptra first. Okay. And then you're numb, and then we do the Fraxel on top of that. So, and also for the arms as well.
And when do you start with Fraxel? Is there, because I know we talked at the beginning about prejuvenation versus rejuvenation. Where does the laser therapy really start to come into play? Does it depend on the patient?
It depends on the patient. It just depends, because the same way that we all age, for the rest of our body differently, from one to the other, our faces age differently. So some people, even in their 20s, are going to have early signs of line wrinkles and freckling and what have you. And so those people, we start in their 20s. Where in the 20s, it's always, it's always nice to get rid of that frown line and make sure you don't get crow's feet that go all the way down to your chin. So, it just depends on everybody's skin type, ethnicity, and what their lifestyle has been.
And how does at-home skincare really fit into that? I know you kind of mentioned it earlier, and I know you have the box, which I feel like really speaks to that also. But in terms of skincare and sun care, how important is that to really establish early on?
Is that really a question?
It's the question for everybody else.
Yeah, no, you can't. It's like, let's just imagine you go and you're going to get your teeth whitened at the dentist, and then you're never going to brush your teeth.
Yep.
What?
Yep.
I don't know. It's so interesting to me that I don't understand why people don't understand that, why people don't get it, that you have to take care of your skin the same way. if you're going to go in the office and spend $1 gazillion and have all these procedures, and then you're not going to wear sunscreen, and you're not going to take off your makeup, and you're not going to apply vitamin C, and you're not going to apply some of the stuff that I've just come up with, what?
Yep.
What? That's ridiculous.
Yep. When do you start patients on retinol or retinoids? When do you kind of generally recommend people start to add that to their routine?
Well, some people use it for acne. And
right.
So, acne, pigmentation. And so those people, you just keep, just stay on it. And then otherwise, it depends on people's skin type, but sometimes you just do it like, it's almost like it's a supplement for the skin. So yep. You just do it a couple times a week, maybe, so that it doesn't make you too dry or too irritated, depending on the part of the country that you live in and what season it is.
Yes.
But it's always good. A little bit, even for a retinol, a tretinoin, even a little bit is good. I really like niacinamide. I really like, obviously, some of the more stable forms of vitamin C.
Yep.
And I really like some of the peptides too. There's a lot of innovation that takes place in skincare. So that's why I developed the box by Dr. Ava, because I felt that there was nothing out there that was curated skincare and at-home devices. And so that was the genealogy of the box. And I have two things coming out. They'll be fourth quarter this year too. It'll be a skincare system designed to sync with your skin, and an at-home device too.
Well, that's a good tease. Can't wait for that. I just saw a question come through asking if you can be too young for a thread lift, which I actually think is a really great question.
Yes.
And
yes. You can. I have seen. You have to. Everybody always has to go back and look at the actresses from, before they were having anything done. So let's say the 50s and the 60s. And you will see, if you look, you'll see that, people, their jawlines aren't like this. They're not, tight. It's normal to have a soft, gentle curve. So if you're staring at your face way too much, throw out that 10X mirror, then you're going to start to see some of these very early jowl formation. But it's like, that's probably too early. I would say, like, for the actresses, we start doing them in their early 40s.
Okay.
Depending on the actress, yeah.
I feel like that's the kind of fine line with some of these things where it's like, we're talking about it all the time. So you're like, oh, it's for me. But I think that's what's so important about going to an expert and going to someone who can really tell you this is kind of the progression of some of these things to take you from that prejuvenation through rejuvenation phase. And I think another topic that I wanted to cover with you was kind of the evolution of lip, because I feel like obviously we had the whole Kylie Jenner craze, going back a number of years now. And then we had masks on our faces for the last 2 years. But nonetheless, I feel like lips still always have that allure. But I feel like there has been a shift in terms of maybe less about size and a little bit more about shape. Would you agree with that?
Absolutely. So, yes, absolutely. So I think that the lip augmentation or enhancement in the past, the way that people were, it has to do with injection technique. So the way that people were injecting, it looks like you're walking around with a couple of inner tubes on your face. It's like, what's attractive about that? I think it looks ridiculous. And so with these other techniques, you can create, you can't change the shape of your lip, really. But you can enhance it so that other people can see it without, getting that inner tube look.
Yes.
So that's where I think the Russians actually have done a good job, because they started injecting in a different way so that you really emphasize the shape, because it's all unique. We all have a unique shape to our lips. So you started emphasizing the shape by injecting sort of different patterns going across. Doing it that way, you do need to have some numbing cream, because it is a little tender to do it that way. But the Russian lip is basically your lip on caviar.
I love that. That's the right visual. And did you find, in terms of the way that the pandemic influenced some of these trends, did you find, we talked a lot about eyes last year. Did you kind of see the same thing in your practice, or were people still kind of thinking about the face as a whole?
I think, my patients, it's really the Zoom effect.
Yeah.
So people are like, okay, yeah, well, I'm outside, or I go you know, I mean, if you go into a restaurant, you're going to take off your mask when you sit down. And so now that the regulations are really getting beefed up, that you need to be vaccinated,
Yep.
you know, that'll start spreading out, especially I think in the next 6 months, so that we can get our lives back, get past this. Anyway, so it's really a whole face. You know, people are looking and they're like, oh my God, you know, I didn't even realize. Some people who don't have a 10x mirror, they're like, oh my God, I didn't realize it looked that way. So, you know, I think it's less about the mask and it's more about the Zoom.
Yeah. Nope. We spend our days.
Exactly.
Well, we spend our days like this, and it's just like you can't help but notice like every little shadow and just be like, oh, do I really look like that in real life?
I'm thinking, man, I'm looking kind of yellow here. But I was trying to give you guys like a little palm tree experience.
This view it's like 20 degrees in New York today, so this view is spectacular.
Okay, good. Well, I'm glad that you got a little, because I got to move out of the sun now, even with my coat on.
No, there you go.
What else did I want to? Oh yeah, and I wanted to tell you about the Carboxy treatment too.
And I'm excited about this because I'll be honest, I feel like this is one of the treatments that is a little under the radar. I don't know if you feel the same way, but I just don't feel like it's gotten as much coverage. But I'm excited to hear you kind of tell us about it before it takes off.
Yes, it's very exciting. So we all know what a mask is, right? We all know what a mask is, but we don't. And they're nice. They're hydrating. They offer some peptides. You can look kind of dewy, but this is a categorical shift in the way a mask affects your skin.
Okay.
So the way it works. This is a Carboxy mask. So when you deliver CO2 to the skin, what happens is there's your hemoglobin. You know, here's your hemoglobin floating around, and there are all these oxygen molecules stuck to it. And so, how do you get those oxygen molecules off? So if you move it, they call it the dissociation curve. So the carbon dioxide moves that curve. So all of a sudden, all your oxygen molecules start flying off, and you actually get a vasodilation.
Wow.
So you get better delivery of nutrient and also better elimination of skin toxins by using a Carboxy mask. And I was introduced to it about a year ago, and I was like, I went to an event and I was treating women, and some of them just wanted a mask because it was in Cabo and they didn't want.
Yeah.
And I was like, I could not believe how much better their skin looked.
Wow.
And I also knew that it enhanced wound healing in people who had laser. And so we've been using it for post-laser treatment, post kind of almost anything treatment, and it really speeds up the healing. Because, as I said, you're shifting that oxygen dissociation curve. You're getting more oxygen delivered. You're taking away waste from the enlarged capillaries. So the Carboxy mask, the one that I really like is the Lumiere.
Okay.
Lumivive, and so that's really exciting. So.
And is that right now just something you're going to find in office, or are there at-home versions of that as well?
So there is a professional version, and there's also an at-home version. And so what I'll do is I'll give you the link to, I don't have it on me right now, but I'll call it a CO2 lift, but I would just want to make sure I have the spelling of the company correct. And there's an at-home version, and there's also a vaginal version.
Oh, interesting.
And that's really for older women or even younger women who've had to have chemotherapy or something that affects the normal lubrication of the vaginal mucosa.
And was Carboxy previously, was it more of an injection, or has it always been in topical form?
No, it was an injection. So, and we still do some of that, to see if you can get improvement in lines and wrinkles. But it's kind of, it's invasive. And so I think this is going to be really, I think like everybody's going to be putting it on once a week. It
sounds like it kind of just optimizes everything else that you're doing. And I feel like the post-treatment angle, anything you can do to speed up that recovery process obviously is great too.
Yeah, absolutely.
And so you, as we mentioned at the beginning, are in Maui. What are some of the topics that you guys are discussing at this dermatology conference this week?
So this morning, it just started this morning. So I just came from the lectures. And so the lectures today were about all these new drugs that are for people who have psoriasis,
Okay.
and for people that have eczema. So that's very exciting. Also, new drugs for itch, like people who suffer with a lot of itch.
Yeah.
Also for toenail fungus, there's something new. And there's later in the week, there's going to be an update on pigmentation, on treatment of pigmentation, and also an update on treatment of hair loss. So, and then of course all of the beauty stuff. So I'm one of the live injecting faculty. So I'll be demonstrating. I don't know, they assigned me a product, and then also we have an afternoon where there's a panel, and so we go through what's my treatment. So we each present like 3 cases, and we talk about what treatment we provided to the patients, and have audience interaction.
That's exciting. I'm like, I wish I could be a fly on the wall and also just be in Hawaii. Both sound wonderful right about now.
Yeah, just saying, it's pretty nice out there.
You guys picked a good spot for it. Well, Dr. Ava, this really was such an honor, and we're so grateful for all of your support. Dr. Ava is also a member of the EDIT Advisory Board, which we're so lucky and honored to have her. And I could talk to you all day, always, but we appreciate you finding a few minutes for us. And to everyone watching, if you missed a moment of this, we're going to save it. There was a ton of information here that I think you're going to want to revisit. So please feel free to bookmark it, watch it. You can follow Dr. Ava at Dr. Ava Says. And we will see everybody soon. Dr. Ava, thank you again.
Thank you, Meg. So lovely to see you. And I'm sorry you're not here with me.
Next time.
All right, bye.
Thanks, guys.
This is
Bye,
everybody.
everyone.